Madison County is considered a red zone, listed as a very high-risk area in Alabama because of our rising COVID-19 cases, and we are actually on the national watch list. With higher numbers, some of our local hospitals are dealing with struggles and have concerns for what is to come. Our Sydney Stallworth tells us more.
The biggest concern, I think, at the moment is staff for hospitals.
Crestwood Medical Center's Dr. Pam Hudson says as local cases rise, medical staff are at a higher risk of being exposed to COVID-19 when they're outside of work or having to miss work in order to care for an infected family member. And a loss of staff could be detrimental.
We can find enough beds. We can manage to cobble together supplies, but it doesn't take just hard work to have enough staff to take care of the patient load that we have. Capacity of non-COVID patients right now is about what our capacity that we experience in the January-February timeframe.
Dr. Hudson says local hospitals are managing for now, but capacity remains a concern as the positive rate for COVID tests is now around 14 to 15%. More COVID inpatients could become a problem.
Our ventilator use rate of those patients in the ICU is actually at closer to 60% than the typical 30%.
And even though hospitals in our area are working to extend testing opportunities, testing kits and equipment are not consistently available. Another serious concern, access to an adequate supply of remdesivir, which has been shown to help treat hospitalized COVID patients.
It is not a straightforward cure, but we certainly don't want to lose that supply, and there has been a shift in where the supply comes from earlier this week, so we are cautiously optimistic that we'll continue to get the medicine that our people need.
Dr. Hudson says she hopes Governor Ivey's new statewide masking mandate will drive cases down and ensure these concerns don't come to fruition.
A small sacrifice to make to flatten the rise in cases.
Putting the Valley first, Sydney Stallworth, WZDX News.